Hi, Dr. Mark Agresti. I want to talk about caffeine. Is it good or is it bad? Caffeine is found in coffee beans, cocoa beans, cola beans, tea leaves. How do we get most of our caffeine? Most people go to Starbucks or Dunkin' Donuts. So you get it in coffee, tea, or soda. But can it be in breakfast cereals? Yes. Can it be in pudding? Can it be in migraine medicine or headache medication or medicines for premenstrual syndrome? Yes, yes, yes. What's the good of caffeine or caffeine? Well, the good of it is it increases energy and it gives you an energy boost. It burns fat. It gives you an adrenaline boost, which will enhance athletic performance. People who drink up to four cups of coffee a day have a much lower incidence, dramatically lower of Parkinson's, sometimes 60% less. Coffee also, college students know this, coffee enhances memory. So when you study when you're drinking coffee, you'll remember things better. That's the good of coffee, and we all know, we all try and take advantage of that. The disadvantages of coffee, well, you drink too much, you get anxious, you get irritable, you have trouble sleeping. Digestive issues are very common with coffee. Gastroesophageal reflux disease, when you irritate your esophagus, you get gastritis, you irritate your gastric wall. Coffee also causes a laxative effect, meaning if you drink too much coffee, you'll get diarrhea. It stimulates bowel movements and helps you go to the bathroom, but too much will cause diarrhea. Too much coffee can also cause a muscle breakdown, so that's a serious side effect. Your muscles start eating themselves. Coffee is addicting. Yes, if you drink too much coffee, you'll eventually become addicted, and when you stop, you'll get headaches and feel uneasy. So the drug-seeking behavior with coffee, where you look forward to that coffee every day and you can't live without it, can't wake up without it, coffee is addicting. People seek it out and may abuse it. Clearly, caffeine raises blood pressure and can be problematic for people who have high blood pressure. Along with raising blood pressure, it raises heart rate, which is a problem. Although coffee increases our energy level, if you don't sleep because of coffee and you keep taking it, you will become fatigued, because chronic coffee use will result in fatigue. Another common thing with too much coffee is tremors. Too much caffeine may also cause frequent urination. Roughly, this study's out there saying, I'm going to give you a round number. More than 500 milligrams a day, no good. Less than 500 can be beneficial. You can take advantage of all the beneficial effects of caffeine under 500, but over 500, you have a problem. Let's just look at some common companies or coffee makers and how much caffeine are in their drinks. Starbucks, for example. A tall at Starbucks is 260 milligrams. So 2 tall coffees a day, you're over your limit. A grande coffee is 330 milligrams. A venti is 415 milligrams. Now remember, more than 500 is no good. Under 500 is good. Dunkin' Donuts, a small coffee is 150 milligrams. Medium coffee is 210 milligrams. A large is 300 milligrams. And extra large is 359 milligrams. Green tea, 2 to 10 milligrams. Black tea, 25 milligrams. And let's say soda, how many milligrams in a Coke is 25 milligrams. So what's the conclusion? You can roughly have regular cups of coffee, about 4 cups a day at Starbucks, 2 cups of coffee a day at Dunkin' Donuts, 4 cups. The moral of the story is keep your caffeine consumption under 500 milligrams, good. Over 500 milligrams, bad. Thank you, Dr. Mark Agresti.